Assalamualaikum, Doctor.
Alaikum salam wa rahmatullah. How are you?
Alhamdulillah. How about you, Doctor?
Alhamdulillah, I'm fine. All of you are okay?
Yeah, very good.
Alhamdulillah. So let us start by Kitab.
Okay.
Who will be the first one to present?
That will be me, Doctor. Putri Sofia.
Botri Sophia, I will be the one to be examined.
I would be the doctor and I would have my colleague be the patient.
Yes, I mean you will be the one who is going to be examined by me. Yes?
Yeah, sorry. Yes.
Okay, so be ready. I am trying just to make it for you as a situation like in the exam. After that, your backup from the other will guide you. And I hope for the next cases, if you can keep the one like you, who is the presenter, blinded from the details. It will be more better for you. I mean, if you don't know what is the case and like that, and you will be astonished when you saw everything and you will remember, oh, this one I know, but I forget this one. I don't know, I can improve this one. I have misunderstanding. I must like that. Okay? Because time is running. I think your time is running soon. Okay, go ahead, Botri.
Okay. So, Assalamualaikum, adik to Dr. Mossad and everyone present here today. So, I'll be the doctor. We begin the case discussion with role playing, followed by discussion as well as OSCE. So, I'll be the doctor and my colleague Iza shall be the patient. So, we begin with the role playing. Yeah? Okay. Bismillahirrahmanirrahim. Are you ready, Iza?
Yes.
Okay. So, Assalamualaikum. I am Putri, year 3 medical student of IIM. May I ask questions regarding your child's condition, if that's all right with you?
Waalaikumsalam warahmatullahi. Yes, we may proceed.
Okay. So how should I address you today?
You can call me Puan Aisha.
Okay, Puan Aisha. So is this your son?
Yes, this is my son. His name is Anas and he's about a year and 10 months old. His name is Anas and about a year and 10 months old.
Okay. So what brings you here today with Anas?
Actually, my son has been having unresolved fever for 5 days duration.
Can you describe more on that fever?
It was on and off during those 5 days, and I recorded his temperature several times to be quite high, which is around 39 to 40 degrees Celsius probably, and it worsens usually at night. So I give him a suppository paracetamol, and it did relieve the fever, but only for about 1 to 2 hours only.
Oh, okay. So was he tired or lethargic looking?
Actually, yes, he does look tired. He was less active than usual, and he was also having a poor oral intake.
Okay. Did he like have any chills, like he shiver and curl himself up?
Yes, he had chills and rigor following the fever.
Was there any night sweats or any profuse sweating?
No night sweats.
Okay. So besides the fever, was there anything else accompanying the fever?
There are actually some rashes, which is my main concern, and it is worsening rashes.
Okay. Can you describe more on that rash? Like when did it initially start, or like when on Anas's body that it initially occurred, and how did it spread?
After the fever, about 3 days after the fever, the rash started. It first started behind the ear, and then it spread to the trunk. There was the rash was red, there was some flared lesions, some raised lesions, and it was also patchy.
Okay. Was the rash, was it itchy and did it leak any discharge at all?
I don't think it was itchy because I haven't seen him scratching himself off. There wasn't any leaking discharge too.
Okay. So besides the fever and the accompanying rash, is there anything else that is he has any of concern, like coughing or anything?
He did have occasional cough. He did have diarrhea too.
I see. So before I proceed with the diarrhea, can I ask more about the cough? Like, can you describe more on it? When did it start, and was it dry or was it productive?
It started on the same day as the fever. It was productive. He would cough out whitish sputum, and then after that cough, he would vomit.
Okay. So when he was coughing, what did it sound like? Was it loud, raspy?
It was more of a
Or was it
raspy and loud, probably like barking cough, I think.
Oh, okay. So so there was no any whooping sound at all, is it? Like when he would cough, he would then he would pull out a whooping sound like that? No.
No, none of that. None of
But so it was just raspy and loud, like a barking cough you mentioned.
yes.
Okay. Besides that, besides the whitish sputum, did he cough out any blood or at all?
No, none of the blood. Only the white sputum.
Okay. How often would he cough, and when did it cough? When did he cough?
It was occasional cough. It wasn't particular on any time.
Okay, so it's occasional. Okay. So you mentioned that after he coughed, he would vomit, right? Can you describe more on the content of what he vomited out? And how often
he would
does that
vomit
occur?
out milk and food particles. His vomiting episodes usually occur about 3 times per day.
Can you? How much would he vomit? Was it like a cup or a spoonful?
I'm not quite sure how much.
Oh, okay, it's okay. No worries. Besides, you said that he had a cough. He had after he coughed, he would vomit. So you also mentioned that he had diarrhea. So can you describe more and can you explain further on that, like how when did he have diarrhea and how often does it occur in a day?
Like the fever, like the rashes, which is 3 days after the fever. On the same day after rashes, the diarrhea also occurs, and he would pass loose stool about 3 times per day. But after he was admitted here, it would increase about 6 times per day of loose stool. It also occurs during his coughing episodes.
What was the consistency of the loose stools?
It was kind of mushy and yellowish.
Mushy and yellowish in color. Okay. So besides diarrhea, does he have any problem with urination at all? Like does he look like he was in any pain or any abnormal color of the urine?
I didn't think he was in pain. He seems lethargic in his last active, but he doesn't seem in pain. There wasn't any blood in the urine, but it was slightly darker in color. And he also have reduced in urination because he urinates only about once per day.
I see. So he had reduced in urine output. Okay. So did he have any like runny nose or sore throat at all?
Yes, he has a runny nose. I'm not quite sure about the sore throat.
Okay. About the runny nose, what color was the discharge of the runny nose? And do you know when it started?
I think the discharge probably yellowish in color. I'm not quite sure when it started.
Okay, it's all right. So it was yellowish in color. Does he have any sick contact in the family at all? So everybody was healthy lah.
Yeah, everybody was healthy. There was none of sick contact in his family.
Okay. All right. So does he have any red dry lips or any peeling skin at all?
None of that.
Did you observe if he had any abnormalities of the tongue? Was it like if his tongue was like swollen or bumpy?
I think the tongue looks pretty normal. It seems like as usual. It smells not red. It was the same as usual.
Did you like happen to see if there's any spots at the side of the tongue, like any white spots?
No, none of that. It looks pretty normal.
Was there any discoloration of the lips, or was it bluish, or any other discoloration?
No.
No. Does he look like he was in pain, or was he irritable if you move his limbs, or any history of joint pain at all?
No. He wasn't feeling irritable. He was just feeling lethargic.
Okay. Do you realize if he had any swellings around the neck or the limb or around the joints? Any swellings at all?
I don't think there is any swellings at all.
Okay, there's no swellings. What about any redness of the eyes?
No redness of eyes.
Okay. Did he have a tendency to bleed or like bruise easily?
I don't think so. He does.
No. Okay. Did you realize if he had any changes in behavior, or if he had any weakness of his limbs, or is it just lethargy? That's all.
I think it's just lethargy. He except for that, there's no changes in behavior.
Okay. Did he look agitated or cry if you move his neck?
I don't think so. I think he's quite fine.
Oh, okay. Did he experience any like seizures at all before this? Like currently after fever and rash?
No seizures for now.
Okay. So for the past 5 days, did you go to a doctor or any clinic before being admitted here?
Yes, actually, I brought him first to Hospital Kemaman for the same reason that they referred us to here, because they said that it was full there. So there, and here we are.
Oh, okay. So did check his temperature there? What was his fever like?
Yes, they checked the temperature to be about around 39 degrees Celsius, and it's the same as the temperature that I usually check.
Okay. So can I ask if he had any, besides the coughing, was there any noisy breathing, or does he look like he looks shortness of breath?
No.
Does he look like any shortness of breath?
On the occasional cough, there wasn't any. He can be fine.
Oh, okay. That's good. So besides that, did you notice that his muscles look smaller than normal, like muscle wasting, or does he look like he's in any pain if he moves his arms or legs?
No, none of that.
Does your child follow the immunization schedule like accordingly?
Yes, as of his age right now, which is about 1 year, he was vaccinated of his age, but it was late for his second dose of MMR vaccine because he was given the intravenous immunoglobulin when first he was diagnosed with idiopathic thrombocytopenia purpura, ITP.
Oh, he was diagnosed with idiopathic ITP. Okay. So since he was diagnosed with ITP, was this his second hospitalization then?
No, actually, it was his third hospitalization. The first time was because of the ITP when he was 10 months old. And the second time was about when he was 1 year old, and he has a simple febrile bleed, and this is the third time hospitalization here.
Oh, this is the third hospitalization then. Okay. So
Yes.
can I ask about his birth history, if you don't mind? Like, how was he delivered, and was there any complications to you or to Anas at all?
He was delivered normally. He was through normal vaginal delivery, but it was induced, and he have jaundice for a week duration. He wasn't warded though for that. Otherwise, I was healthy and he was healthy as well.
Okay, that's good. So when he was delivered, how many weeks was that, and do you remember how much he weighed at that time?
He was delivered full term and the weight about around 3 kilograms at that time.
Okay. All right. Oh, was he breastfed like exclusively, and when did he start weaning?
I breastfed him for 6 months exclusively, and then I introduced him to solid food later on, along with the formula milk. So he's now on formula milk too.
Okay. So since he's now on formula milk, so how much would you feed him, and what solid food does he eat often in a day?
Probably about 7 ounces of formula milk 6 times per day, and then he would also eat half a bowl of rice about 3 times per day.
Okay. Was there any food allergy or any drug allergy?
None so far.
None so far. Okay. May I ask about you? How old are you, and how old is your husband as well?
I am 39 and my husband is 43 years old. So both of us are actually medical doctors.
Oh, I see. Okay. So both of you does both of you have any non-medical illnesses at all currently?
No, we don't. We don't have any.
Don't have any. How many kids do you have, and including Anas as well?
So including Anas, we're about 2 boys and 3 girls. Anas is the youngest.
Youngest, okay. Does his sibling has the same symptoms as him? You mentioned there's no sick contact, but does his sibling have the same problem or have any medical illnesses?
No.
Two
Yes, you're correct. There were no any sick contact. There were no siblings is alhamdulillah well.
Okay. Where do you live, and was there any fogging done recently there?
We live in a double-story house in Kemaman. There weren't any fogging recently that year.
Okay. Who would take care of Anas if both of you are like busy medical doctors?
So on weekdays, usually it's taken care by our housemate, but we plan on introducing him to the nursery center soon.
Okay. Any traveling done recently?
Except for traveling to our hometown in Kuala Terengganu, there was none other travel history, none outdoor activities as well.
Okay. And can I ask like last one? Like compared to his siblings, how is his development?
I would say similar to his siblings. It's quite the same.
Okay, it's normal. What about his vocab?
His vocab probably consists of 10 words. He can't form 2-word sentences yet, but he can recognize and is able to show body parts. He's also able to look for fallen toys.
How old was he when he started walking?
He started walking when he was 13 months old. 13 months old.
Can he wave goodbye or have any anxiety with strangers?
Actually when I go to work, he would wave goodbye. He would cry just like other kids, but he would get by. Actually, I'm quite reluctant to give him to a nursery center because he's still scared of stranger right now.
Okay. So about your housing, are you equipped with like basic amenities? Is there any infestations or is this enough equipped?
Yes. We are equipped with both water and electricity. Alhamdulillah.
Okay. So I guess that's all. Puan Aisha, thank you so much for answering all my questions.
Thank you. It
You're
was,
welcome. No problem.
the knowledge for pottery are very clear, but your role player looks like judicial investigator. You must put a simple atmosphere to the, you don't have a list and you are going to ask him and register it. It is not like that. It is not criminal. So we must take care that our,
I see.
you have a good details about your job, but mustn't be restricted like this, okay? At least during the introduction,
Okay.
must be able to say, hi, good morning, how are you? I am blah, blah, what's your name? What do you do? And you get some details, even from the baby is still in your tummy and go through it. And then you are going to ask about familial issue and the social issue. All this is the benefit of the patient to get the final conclusion. So at least you, and then if you have something which is bad, try to sympathize. If something good, oh, good, like that. So don't make it very formal, please. I know the time, but even if you put today 20 minutes in the exam, you may get less than that. For modified short cases, you need to concentrate in the for about 10 minutes to collect the related important issue to the disease. Okay. So can you summarize now, Butri?
Okay, so my patient, Anas, a 1 year, 10-month-old Malay boy, he was admitted to ED Sasmek due to persistent fever for 5-day duration, as well as a worsening rash. The rash was maculopapular in nature and it spreads cephalocaudally. It was associated with cough, coryza, diarrhea, reduced in urine output, and post-passive emesis.
When this patient was admitted?
Like the case, is it?
Is it an old one? Because we have
yeah, it's an old one. It was
a very nice case.
A year ago or 2 years.
We have a very nice case in the world now, hoping if you are allowed to come inside to put the history. It is a very, very interesting one. Okay, so can you tell me what's your diagnosis?
My diagnosis is viral exanthum secondary to measles. This is because the patient presented with fever, cough, coryza, as well as maculopapular rash that spreads cephalocaudally. So it started behind his ear and spread to his trunk. Furthermore, he had a delay in his second dose of MMR vaccine because he was diagnosed with idiopathic thrombocytopenic purpura. Besides that, he had diarrhea as well. However, the points against it that he does not have any conjunctivitis, which is like the 3 C's in measles, cough, coryza, and conjunctivitis. My differential diagnosis would be rubella.
For measles first, how can we confirm the diagnosis?
If measles, it is diagnosis is usually made clinically. So if there's any, it's made clinically because the rash will occur 3 days after the fever. But if we can do a investigation as well, like PCR or viral culture, viral isolation of tissue culture.
So Zakwan, if you got a diagnosis of measles, what is an important action must to be done?
For measles, it is usually a symptomatic treatment.
I'm asking Zakwan.
Yes?
I'm asking Zakwan.
Okay. For measles management, Doctor?
Not management. Now you got a patient with a rash, and once admitted, you realize that it is measles. What is important decision need to be done?
maybe we can manage the symptom first, such as we must maintain the maybe fluid intake,
You are
and
speaking
because
about
of this patient.
you are speaking about management. Yes, it is very clear. Any other thing?
Um,
Adib?
Should we look for the character of the rash? Like for measles, it's very specific as of complete spots.
Okay. Any more? Adib?
Aside from that, I think I'm agreeing with Putri with the use of PCR to detect the antibody as well as.
Okay, so very important to get a blood test for the measles, but there must be, because your role is to protect the patient and protect the world. So if we got one patient of measles or suspected measles, we must hurry and put him in isolation room. You cannot leave him in the world. Otherwise, he will infect all other kids. So number one is the isolation. Number two, after confirming, we must do notification, because there is an important notified disease. If we do not notify it, it will be problem with time. Okay, so don't forget those two important. Of course, Butri will ask here about the management, but this is an important, because your role as a doctor is not limited to the patient. A lot of details, how to protect, and then how to protect the other patient, and how to notify, because some cases are very urgent in the country, like the first case of COVID, which was detected. It's very important, okay, because it realized the community that there is new diseases started to evolve. Even dengue fever is notifiable disease. Why? Because they need to go and do fogging. At least they are trying to decrease that area to be more infectious. That is the important, okay? So what is the diagnostic test for measles? Clinically, let us agree with you, it is a measles. What is
So for the
specific diagnostic test?
serological test to test for antibodies,
Very good.
antibody titer.
What type? What is the difference, Afika, between IgG IgM?
IgM is usually initially IgM will be first and then followed by IgG. IgG will be a later stage.
What is the mean gum first? He is the eldest one?
Like it will, or IgM it will be produced first, followed by IgG.
No. Atika, what is the difference between IgG and IgM for any virus, for any disease? What is the significance? Let us say if I got for any disease, for toxoplasma, rubella, cytomegalovirus, for measles, IgG positive, IgM negative. What does it mean?
I think, for example, in dengue fever, so it indicates the stage. For example, IgM would be rise. I'm not sure that.
Okay,
Doctor, is it?
Nikhil Musawi?
Yes, Doctor. Is it to differentiate between the current infection and
Yes.
The past infection? And
Thank you. This is a very important. Because if I got IgG, it may be either this disease came from the mother to the baby, like many cases of congenital infection. I will do herpes simplex, toxoplasma, rubella, like that. If I found IgG, still it can be transmitted from the mother because IgG can pass, but IgM cannot. But after that, after the first year or after 6 months, there is no more bond between the child and the mother for 6 months. So IgG means previous infection. IgM means new injection. Yeah. Please, someone of you write a short summary between the importance of combination between IgG and the IgM and what is the benefit of each one of them. And try to send it, please, to me to drop it to the group. It is very, very important because some people who didn't know, they see like I did rubella for the mother who is pregnant. She came IgG. It means she has infection before. When is it current one or not? So I must do IgM. Otherwise, I will diagnose all ladies with rubella and I will diagnose them as rubella of pregnancy and do a lot of trouble, okay? So I will do both IgG and IgM. Okay, can we go to you one by one to tell me differential diagnosis, please? First, the differential diagnosis.
Okay, so for the first, should I show the slides or should I just say it, doctor?
If you are going to show the slides, okay, go. Okay, you can start the presentation.
Shall I explain like the HOPI, the history of presenting illness as well, the whole history?
No, go for differential diagnosis, please.
Okay. Okay, so for the first differential diagnosis, it will be rubella because the patient presented with fever. There was also he was lethargic and also maculopapular rash that spread cephalocaudally. And he also had a delay in the second dose of MMR vaccine. However, the point against is that he does not have any lymphadenopathy and there is no conjunctivitis. And the patient also presented with a cough and coryza. For the next differential diagnosis, it would be.
Come back to it is very important.
Yes, sir.
Yeah, rubella is very, very important disease. You said the point 4 is that maculopapular rash, but point against is school age. Why?
What I read is that it does not occur. It can occur through a mother to a patient via transplacentally, and often occurs in child or adolescents. That's what I read.
No. But that's why we did now. We are giving upon infancy and upon entrance of the school, and then go for secondary school, especially for girls who are giving them booster dose of MMR like that, which will protect them. Otherwise, if it occur, it can occur in the age. If we have now something which I hope you can try to manage with us, the anti-vaccine one. Okay, why no lymphadenopathy? Lymphadenopathy usually can occur in rubella, especially in the occipital one.
Yes.
So why you said it is point against? I cannot understand.
The patient does not have any lymphadenopathy. That's why I wrote there no lymphadenopathy.
Lymphadenopathy, absent conjunctivitis. Oh, good. So what else? Even
Yeah.
you mean point against? Okay, you are looking the negative for the negative. Okay. Also, the rubella can have also some sort of reactive arthritis. Known for some patient to have like arthritis, and it is very important. Rubella is a short course. Rubella is a short course of measles. It's just they call
Yeah,
it
it's a 3-day measles.
nowadays in
3-day
our
measles.
3 days measles. Okay. Before our days, about 30 years ago, when anyone go message, they are going to do party for all girls of the area, and ask him to expose to this lady with rubella, so are infected before became pregnant. Now, alhamdulillah, we have vaccine which can do the same job. Okay, continue.
So for the next differential diagnosis, it would be infectious mononucleosis because the patient present with a fever, lethargy, and also maculopapular rash. However, the points against is that there is no lymphadenopathy and no sore throat. Because for infectious mononucleosis, they have three main things, which is fever, pharyngitis, as well as lymphadenopathy. However, he does not have it, so that is the points against.
Okay, Adib. Adib,
Yes, doctor.
what is the causative organism for infectious mononucleosis? Because your colleague is very bakhil to write even the causative organism.
It's the EBV, Epstein-Barr virus.
Epstein-Barr virus, very important. This one, just remember of infectious mononucleosis, it must be included in the differential diagnosis of these rashes and the lymphadenopathy and the source root. Usually we can put the figure of membranous tonsillitis. If you didn't notice it correctly, you are going to think either diphtheria or bacterial one, okay? But it is very important if someone can open the Mr. Google and ask for infectious mononucleosis OSCE, I mean photos, okay? Very important. Now we also have infectious mononucleosis panel for investigation. If you have a patient, you must remember that it can cause splenomegaly and hepatomegaly in some cases, up to 5% for the liver and more for the spleen. And remember for the infectious mononucleosis that their spleen are so fragile. So if you found one patient with infectious mononucleosis, don't be rough. Even if you try to just check the spleen, because there is recorded cases of rupture spleen due to trial of examination. If someone defined the spleen, no need every time and then to repalpate it again because they said it will be so fragile. Okay, good. Next, differential diagnosis. Please, if you're able to add the details which are speaking about in the slides and send it after that, okay?
Okay. Doctor, can I ask, is like splenic rupture very common in infectious mononucleosis? That's why I have to take care.
It is recorded. It's so fragile. Even we ask the mother if we think it is infectious mononucleosis to keep him from any trauma. Because the spleen are enlarged and so fragile with this EBV. Okay.
Okay, doctor. Thank you. So for the next differential diagnosis, it is Roseola infantum, because the patient present with the fever, the lethargy, as well as macular rash on the face and trunk, and also diarrhea, vomiting, cough, and coryza. However, the points against is that usually in Roseola infantum, the fever would be for 3 to 5 days, and it will abruptly subsides, and then followed by the rash. And also the macular rash would begin at the trunk and then it will spread to the neck and the proximal extremities. And there is also Nagayama spots or uvulopalatoglossal junctional ulcers. However, the patient wasn't sure if there is any abnormalities of the throat and also the side of the mouth.
an important for Rosella infantum. What is the name of other disease of this Rosella?
Xanthum subitum.
Yes. And there is also another definition with a number you need to eat. Fifth disease, sixth disease.
Oh.
You must be able to what is the fifth, what is the sixth, and what is the first and the second and the third and the fourth. They started before, said if measles number 1, if rubella number 2, like that, this Rosella will come to be fifth disease, the sixth disease is like that. So try it also to include it. It is a part of the history, but it is very beneficial because nowadays you may within short time thinking about the classification of coronas, the classification of like that, to know the history of the progression and the difference, because many of these are from the same family. Okay, an important issue with Rosella, I don't know you didn't mention or not, is a very diagnostic point. Anyone knows it? Zakwan? Very diagnostic, because usually if you know something specific for everyone, it will be easy to differentiate. The Rosella infantum, of course, its name is red. You will find the baby have a red rash. But at the same time, when this patient will be presented by Zakwan knows, or should I inform you?
I think it is Xanthum subitum.
Yes, I mean the diagnostic one is that the patient got a very high fever for up to 3 days or 3 days plus, and once the fever drop, the rash appear. So the patient will come you very hot, very hot, very hot, and then the mother tell you, Alhamdulillah, today the fever started to settle, but the rash came to the child. One of the practice for that disease, so you must know it, okay? I think you will find it in New Nelson also. Good. Okay, don't forget this point because it will help you in the diagnosis. Okay, next differential.
Okay. So for the last differential is Kawasaki disease, because the patient had a fever for at least 5 days duration, and he also has a maculopapular rash as well as diarrhea. However, the points against is that the patient does not have any conjunctivitis. There was no any mucosal changes. There was no red, dry, cracked lips and strawberry tongue. Also, the rash should be polymorphous, and the patient also did not, the mother said there is no lymphadenopathy, any edema of the limbs, or any peeling of the fingers and toes.
But your no needs some addition. So, Noor Afika? What she didn't, she forgot.
Yes, doctor.
What you forgot to put about Kawasaki, which is the most important and the most dangerous time. What is
the very tongue?
one patient of Kawasaki? Why you are very panic? What is the dangerous organ which can be affected?
Coronary artery.
Oh, so we cannot miss that, because this is our point. Even if you have partially presented Kawasaki, you are going to do sometimes echo early just to rule it out, because this is the most dangerous. If you have any type of carditis, because it can cause a lot, but the most famous and the most common one is the coronary artery. So normal heart or the normal echo are very important. Okay, so don't forget this one because it is one of the diagnostic. And one of the most important point which we will define. Anyone knows just by name what is the treatment of Iza? Can you ask what is the treatment of Kawasaki? Just the line. I know that you are year 3, but still you need to know general lines. Iza?
Yes, the treatment of Kawasaki disease.
Yes.
We give him immunoglobulin.
Yes. Why you are very hesitant? This is a very important one. IVIG. Okay. Even if we suspect, sometimes we need to start it urgently because it has a very dramatic response if we start. Okay. So IVIG, and one more word, enough for you. IVIG and one aspirin. If there is suspicious of coronary artery or there is coronary artery, we are going to upload by like that. So it is very important to remember these two words, IVIG and aspirin. So Butri, is it your last differential?
Yes, doctor.
I think you must come back and research what is the first, second, fifth, and sixth diseases. Okay.
All
All of this will enter on your differential diagnosis. And also we can consider, I know this type of rash are maculopapular rash. Okay, so it is a maculopapular rash. I must consider another like bacterial infection, like staph, is. So just one photo about the 4 types of staph infection of the skin, which also some of them are life-threatening. Okay, and if it is like strep, also we have another diseases can occur by streptococcal disease and causing a fever and skin rash. There is another important, if it is vesicular rash. Okay, so what can be differential diagnosis, Afika?
Which Africa, doctor? No Africa or Africa Atira?
Nur Afika?
Yes, doctor.
Are you here? What is
Yes.
rash is
Varicella.
very good. So varicella is very important to be ruled out. Irdina, what else?
How about hand, foot, mouth disease?
Yes, very good. What else? Very common virus, but it is very dangerous for skin, especially if they are just delivered or they are immune deficient or like that, is the herpes simplex infection. Okay, so that is a very important. Of course, also, Butri, you need to add, your colleague just presented for me before a case of scarlet fever. Okay, so you must put it in the differential diagnosis. So I need now to let you understand how you are suggesting of different scenario of the main symptom. I mean, now we are presented fever and rash. I may got it. Alhamdulillah. I know today that measles can come. Okay, and we will get before the rash of the body appear. We will get something in the mouth which is known as
Conflict spots.
okay, which is pathognomonic for measles. And you must. I need to see it also in the Mr. Google. Okay, now just present it at the end. So it is very important to know what is this complex. And then when the measles are appear, we said that the measles looks like a small curtain area. I mean, it will start from the head and go down, and the curtain is down. When I came down, my upper part is already improved like that. So the distribution are very important. And we must know the complication, okay? Measles, especially if the patient is immune deficient or even not immune deficient, but very weak or anemic or like that, he can present it to very bad complications, okay? Because we don't have antiviral for measles. Even if we go for varicella, we can give him acyclovir like that, okay? Okay, let's do in the next few minutes your OSCE.
So the OSCE will be presented by Iza.
Bye.
By Iza.
Okay.
Maybe. Okay, so next slide. So present the ski. Okay, the first ski, there is the picture of the rashes. So an unvaccinated child came with a low-grade fever, lymphadenopathy, and maculopapular rash that appeared on the face and that spread self-locally. So name the likely diagnosis, the causative organism, and the differential diagnosis. So can I ask Atika to answer these three questions?
Okay, for the most likely diagnosis, question number 1, I think so it's rubella, since it has low-grade fever. And then for the causative organism, for rubella, it's Toga viridae. And then for the differential diagnosis, measles, because it has macular papular rash, and also it spread cephalocaudally, which is very typical of measles. And then we have Rosella infantum, and then infectious mononucleosis, since it has the lymphadenopathy.
Okay. Next slide. So yes, the likely diagnosis is the rubella because of firstly the lymphadenopathy, and the rashes are patterns spreads from the head to the trunk, and the most common causative organism for rubella is Toga viridae. The other differential diagnosis where similar presentation is the measles, the Rosella infantum, and also the infectious mononucleosis. Okay, next, Oski.
Don't forget that infectious mononucleosis, okay? If you give the patient amoxicillin, he will get a rash.
Oh.
Very famous for it, okay? So if you suspect, don't go for amoxicillin groups. If you need to give antibiotic, okay? Okay.
Okay, next. So the next is the lesions that is located on the cheek of the child. So a child came with the high-grade fever, cough, coryza, and maculopapular rash that appear on the face, at the hairline, and spread downward toward the neck, trunk, arm, legs, and feet. So first name the lesion, the likely diagnosis, and the causative organism. Can I ask Zakwan for this?
Name of the lesion, this is a complex spot. Likely diagnosis, I think it is measles, causative organism, rubella virus. Yeah.
What is the causative organism? What he said.
Okay.
What the causative organism is?
It is about measles virus.
Okay, if you need to say it is Ribolla, but not rubella.
Ribolla.
Yes, okay.
Ribolla.
Okay.
Okay, so next. Next slide, please. Okay, yes, what has Zakon stated, it is true that its copic spot is located on the buccal mucosa or the cheek, just along the molar tooth. And then the likely diagnosis is the rubella, and the causative organism, which is a rubella virus or paramyxovirus. Okay, the next one. Okay, so the last is, this is the picture of the tongue and the lesion of the tongue. So the child came with fever for 6 days duration, injected throat, general rash, cracked erythematous lips, and peelings of the fingers. So what is the name of abnormality of the tongue, likely diagnosis, and complications of the above disease? Can I ask for Nur Afika? Answer this question.
Yes. So the abnormality is strawberry tongue, and the likely diagnosis Kawasaki disease, and the complication coronary artery aneurysm.
Can you?
Yeah, that's correct. Okay.
One more question: differential diagnosis of the strawberry. What is the name of the tongue and the possible diagnosis are very important. Any other diagnosis?
Scarlet fever.
Scarlet.
Yeah, scarlaturia. Any other? Okay, so at least you must know this top two important one. Okay. Good.
Okay. So the lesion is the strawberry tongue, and the likely diagnosis is Kawasaki disease. Differential diagnosis, as stated earlier, it could be scarlet fever as well. And the most important complications of Kawasaki disease is the coronary artery aneurysm, which is associated with the carditis. Okay, that's all for the OSCE questions from me. Thank you.
Subhanallah, the issue of rheumatic fever must be considered, okay, because also the rheumatic fever has carditis and they have also tonsillitis and they have some skin manifestation. You must know the manifestation of rheumatic fever, and this give you a meaning of Allah must test all. In the developed country, they don't know what is rheumatic fever. It is very rare. Then I remember one time we came to the diagnosis of rheumatic fever and then asked me, please, doctor, can you manage this case? We don't really have any. We read a lot, but we didn't handle it before. But nowadays, it is the same problem. It came, but not through the microbe. It came through the autoimmune. And until now, they don't know what is the mechanism, true mechanism, which can precipitate somebody to get autoimmune and not to get it. Okay? So that's why this is the Islamic concept. Always ask Allah to protect you, ask to get early diagnosis and the treatment. And they said, Alhamdulillah, for anything, because we don't know. Nowadays, they are mad. If they saw a patient with some fever like that, they are running to give IV, IG. And as you know, the previous patient with us was not give the vaccination, because if you give IV, IG, more than 50, 100 milligram, you must postpone any vaccination for up to 9 months, 9 to 11 months. It is not so simple, because any vaccine we will give, it will be distracted. So this is the issue. to remember that Allah may test everyone by different thing, but the Muslim usually is acceptance the qadar and qada, and he is a patient and he is asking Allah to relieve and reward, inshallah. Okay, that's good. Don't forget to put your Islamic point in the sense, even if you give hope, because Islam usually give hope. Even the Prophet ﷺ went to a man who looks very diseased, and he asked the colleague just to give him hope. نفسوا له في القدر فإن كل شيء يجري بأمر الله. Because sometimes the doctor may die before the patient with chronic disease. No one knows. So that's why try to give hope for every patient, whatever his situation. We have a lot to do. It's a very good thing to tell him from the medical point. We have a lot to do. Your case have no treatment, but we have a lot to do. Until now, no one knows how to manage, but we can do blah, 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 to make the patient as better as we can. So try to give hope, because giving hope is a part of the Islam, okay? I hope for the second presentation, we can finish to 2:15, so I can breathe Dhuhr before the next, inshallah, meeting. Don't forget to complete the slides and drop it to me again, please. Okay?
Okay, doctor.
Okay.
Okay, I will present the next case. Doctor, is it possible if I don't turn on my camera because the connection is not stable? So I'm afraid if I open the cam, it will be lag.
Sure, your voice is the top important now. Okay.
Okay. Sorry, doctor. Okay, for the presentation, for my part, we will, as usual, we will start with the role play. I will be the doctor, and I will have my friend here, Edina, who will be the patient's mother. So Edina, are you ready?
Yes, can you hear me?
Yes.
No.
Okay, Assalamualaikum. Okay, we can start now, I think. Okay, Assalamualaikum, Puan. I am Dr. Afika. I am the doctor in charge today to see your son. So I'm here today to ask you a few questions that might help to know the problem with your son. Is that okay with you, Puan?
Yes, doctor, I'm fine with it.
Okay, great. Before that, how should I address you, and what is your relationship with this patient?
You can call me Puan Irina, and I'm his mother.
Oh, okay. What's your son's name?
My son's name is Anik, and he is 1 year, 2 months old.
Okay. Okay, Puan Irina. So can I know what makes you come here today?
So my son was having fever a few days ago, and it was not resolved since then. So I'm also worried because I did notice there's also some rashes all over his body.
I see. So the main concern is the fever was not resolved, right? And there were also rashes all over his body. Okay, about the fever, can you tell me more about the fever? As when did it start? How was the fever progressing?
He suddenly had fever around 6 days ago. On that day, my son suddenly appeared unwell, and when I touched his body, it was warm. I did give him paracetamol before this, whenever he had fever. And then after I give him the medication, the fever will relieve after that. However, this time the fever only relieved temporarily, and his body became warm again, and he appeared unwell a few hours later. And then because the fever was still not resolved, I brought him to the clinic on that day. I remember that the doctor at the clinic mentioned that his fever was around 38.9 degrees Celsius. He then prescribed my son a few medication. And then 2 days after our visit to the clinic, which is yesterday, my son started to have fever again,
and I brought him to see the same doctor at the clinic. And then he then asked me to come here today.
Oh, do you know the medications that were given to your son at the clinic? And did your son comply to the medications?
Yes, I remember there were antibiotics and paracetamol were given. And I also did make sure that my son took all the medication as instructed. Despite taking all the medication, the symptoms still not resolved, so which makes me worried.
Oh, I see. So can I confirm back? So the rash appeared on the same day as the fever, right? Okay, so don't worry, Puan Edina. We will try our best to figure out the real problem with your son, and we will try the best to treat him as well. Okay, you also mentioned about the rashes. Now, can you tell me more about the rashes?
Hello, can you hear me?
Yes.
So you asked about the rashes, right? So
Yes, the rashes.
the rashes
Yeah.
developed on the same day with the fever. I noticed the rashes first developed on his chest, and then few days after that, there were also rashes at both of his shoulder.
Sorry, Dina, I didn't. Can everybody else hear Edina clearly? Or I'm the only one.
Okay, so
Edina,
the
can
rashes
you
developed on the
repeat
same day
the
with the fever.
yeah.
Yeah. So rashes developed on the same day with the fever, and then I noticed the rashes first developed on his chest, and then few days after that, there were also rashes at both of his shoulder.
I see. Can you describe the characteristics of the rash?
So about the rash, when I touched the surface of the rashes, it was rough. I would say it felt like sandpaper. And then when I put on pressure, the color will become pale and the color will become pale. And when I put away my hand, the rashes started to become red again. Also, sometimes we cannot really appreciate the rashes because it will blend with our normal skin color, right? But then these rashes on my son, I can see the border between the rashes and normal skin clearly.
Oh, so when you said about the applying pressure and then the color become pale, and then when you put away your hands, the rashes started to become red again. So it's like blanching, right?
Yeah.
Okay. So does your son complain that the rashes were itchy, or were there any ulcer lesions, bleeding, or skin color changes apart from the rash?
Yes, my son always tried to scratch his skin, and I will always try to stop him from scratching too hard. I was afraid he will hit himself, but for now I does not notice. I just notice rashes, but does not notice if there is any ulcer lesions, bleeding, or changes in skin color.
I see. Did you put on anything to relieve the itchiness?
No, I did not. I just asked my son to be more gentle and not to scratch too hard.
Okay. So apart from the fever and rashes, are there any other problems with your son?
Yes, he also had cough and runny nose. I also noticed sometimes there were sounds when he breathed out.
Okay, I will ask first regarding the cough and runny nose. Do you notice any sputum or blood when he coughed? And did he vomit after coughing? And what's the color of the discharge from the runny nose?
So there is no sputum and blood, and he did not vomit after coughing. And then the color of the nose discharge was clear.
Has your son been exposed with any sick patients? For example, patient with known case of measles, chickenpox, or COVID? or has he been going anywhere recently?
No, because due to COVID-19, so I took extra care of him and I didn't allow him to go outside.
Are there any family members that have the similar symptoms as your son?
No, just him.
Okay, great. Now regarding his noisy breathing, was the sound very loud or was it anything like barking or whistling or whooping?
As far as I know, nothing like that. It was only mild and it just occurs sometimes. I hardly heard the sound and only heard it when I brought my ear closer to my son's face. Then I can appreciate the sound.
Or does you and your husband have any other medical problems or any close relative that have one?
No, not that I know of.
Okay. Now, does he has difficulty in breathing or rapid breathing, shortness of breath, or did you notice any changes on his chest when he breathed?
No, he breathed normally, and the only changes that I noticed was the sound when he breathed out.
Or sorry, I forgot to ask. Does you and your husband have asthma?
No.
Okay. Does your son's symptoms, which are the fever, the itchiness, the cough, the runny nose, disturb his sleep?
As far as I know, it's okay.
I see. Are there any dengue cases in your housing area, or do you notice any fogging activity recently?
No,
Okay. Did your son ever complain of showing signs of abdominal pain, joint pain, or pain in the eyes? Maybe he cried.
no,
Okay. Did he ever vomit? Not only after cough, but I mean like nausea and vomiting symptoms, or were there any alteration? And was there any alterations or
no, I don't think
abnormalities
so.
when he defecate? Okay. How about his urination? Were there any problems?
I think there is none of that.
Okay. So no urinary abnormalities, right?
Yes.
So did you notice any swelling at the hands or legs or anything like bumps or lumps anywhere at the body, especially at the neck area?
No, I was always changing his clothes and put on baby powder on him after bath. So I would have noticed if there is any swelling on his body.
Okay. So regarding his behavior, were there any changes in his behavior? And were there any problem with his senses, like his vision, his hearing, that you noticed?
No, I don't think so.
How about any weakness?
Also, no.
No, okay. Did he took the vaccination following the schedule? Also, does he has allergy towards any food or drugs?
He has been vaccinated up to his age and he has no food or drug allergy.
Okay, great. Does your son has any other medical illness or history of hospital admissions before?
No other medical problems, but he was once hospitalized because of caput secundum right after birth.
Oh, caput secundum. Were there any complications from that conditions that require you to go to hospital?
No.
Oh, okay, so it resolved. It has been treated properly and resolved. Okay, how about his birth history? Were there any problems with you and your son before, during, and after pregnancy?
No, we were all well.
Okay, does he has any siblings?
No, he is the only child.
Okay, about his growth and nutrition, were there any problems that concern you? And you can you tell me more about his diet?
I think his growth is okay. He stopped breastfeeding after 6 months, and now he eats what my husband and I eat, like rice, chicken, vegetables, and also fruits.
Okay. Has any way your son has ever been assessed regarding his developmental progression?
During my last visit to the clinic, which was a few days ago, the doctor did assess his developmental progression, and the doctor said that it was according to his age.
Okay, good. Where do you live, Puan Idina? Does your son stay with you?
My house is like in Ramah Kota, and yes, we live together with my parents and my sister, and my son's aunt.
Okay, Puan Idina. I think that will be all, and I think I already have enough information regarding your son's condition, but still I need to run some tests to confirm the diagnosis. Are there anything else that may concern you?
No, doctor, I think I already tell you everything.
Okay, thank you so much, Puan Idina, for your time.
Okay, doctor, thank you.
Okay. How can we, you can tell us 2 sentences about the diagnosis?
Sorry, doctor?
2 sentences for the diagnosis.
You mean the summary?
Yes.
Okay, my patient Anik, 1 year, 2 months old Malay boy with no known medical illness, presented with unresolved fever that was acute onset and high grade in nature for 6 days duration. That 2 sentences.
Okay, so what is the diagnosis?
Sorry, doctor, the line was unstable.
Okay, no issue. So what is the diagnosis?
Sometimes the diagnosis would be scarlet fever.
Scarlatoria. Okay. Why?
Scarlet fever secondary to pharyngitis.
Why you diagnose scarlet fever? Clinically?
So from the presentation, the fever was acute onset and high grade in nature. And there were rashes that the characteristic was sandpaper-like in texture. There were also sore throat that might be the cause of the infection. That's why scarlet fever secondary to pharyngitis. And there was also strawberry, yeah, that's it.
Very important. Another, it is some clinical signs you can find in the skin. You know what is Bastia sign?
Circumrapella.
No.
Yeah, the anticubital fossa petechiae.
Yes, Bastia signs. It is aligned.
Bastia lines.
Yeah, it is aligned. Very important to detect. You didn't specify about any lymph nodes or not. So what?
She did.
She did. Yes, she had. Okay. So
there weren't any lumps or bumps or any swelling on the body, on his son's body.
So what is the causative organism? Afika or
Group
Afir?
A Streptococcus. You can call me Afika.
Okay, because you are too Afika now.
The causative organisms is group A Streptococcus, specifically Streptococcus pyogenes.
So group A, beta hemolytic streptococci, very important. Can be cause another problem.
Yes, the same exact organism can cause, like we mentioned before, rheumatic fever.
What else? Or Afika.
Yes.
What is the second one? She said can cause rheumatic fever. So Nur Afika, what can be the second disease caused by group A beta hemolytic streptococci? Very common. This microbe. Anyone knows?
Very common.
is it rheumatic heart disease, doctor?
Yes, she said can cause rheumatic heart disease. Another one. Try.
Anxiety.
Throat.
Group B hemolytic streptococci can cause rheumatic fever and glomerulonephritis, post-streptococcal glomerulonephritis. Don't forget, the same microbe can cause glomerulonephritis and can cause rheumatic fever. Usually, rheumatic fever will come from infection of the throat, but still, sometimes it can come from the skin. The post-streptococcal usually will, glomerulonephritis will usually come from the skin, but still can be some cases recorded from the throat. So the issue of this organism, Achika, do you know what is the mechanism of this organism to cause rheumatic fever or?
Atika or Afika? Sorry.
Achika.
Atika. Okay. Atika.
Okay. Oh, okay. So your question is that how this organism cause rheumatic. Okay. Mechanism, right? So it's so when this organism infect the children, so it will produce antibodies. So these antibodies cross react with the antigen in the organ,
So
which is the cardiac muscle.
Yes, one word which is autoimmune.
Cross react.
Okay, it is autoimmune one. It means the body now, after infection of the GPS, became very excited and he make a defense mechanism. Okay, this defense mechanism must go for the group A beta hemolytic streptococci to distract it. But unfortunately, this a big hit will go to different organ. If it came to the heart, it will cause myocarditis and valvular disease. If it came to the joint, it will cause arthritis. If it came to the brain, it will cause chorea. If it came to the skin, we know the lesions. If it came to the kidney, it will cause post-streptococcal glomerulonephritis, like that. So this is a sort of autoimmune. That's to consider. Sometimes we need to add like corticosteroid in our management in the active and the severe disease if accompanied by carditis and like that. Okay, so it's very important. And remember that they used to say that the rheumatic heart disease will it is like a dog. Sorry, the dog will like the joint and bite the heart. It means he will not cause persistent trauma or persistent destruction to the joint. He just, this dog, like it, no harm until now. But when he came to the heart, will bite the heart, either aortic or mitral or aortic and mitral and another group. That's why to suspect all this complication after streptococcal, because it is very important. Even if some patient came to you, which is a very common, this patient has sore throat, tonsillitis, tonsillopharyngitis, you must ask, is there any family history of rheumatic fever in the family? If they don't know what is the meaning of rheumatic fever, if anyone has a cardiac problem, especially in the youngest age. So all this is our important responsibility. I mean to have a high index of suspicious, to think deeply about protection of the child, not only he came to me for a task, my baby have this problem and I already write my management for him and tell him goodbye, hoping he will be okay. It is not enough, okay? So pathophysiology of the disease, what is the suspected complication are very, very important. Okay, come back again to Africa. The
Yes,
exam.
doctor.
So we speak about this one. So how can we diagnose it through the investigation? As you know, you must remember that we have about 70% or above of the diagnosis can come to your mind if you are a good historian by 70% or more by the history. And about 20 or 25% can come by through the clinical examination. And the remaining 5 or 5 plus will come through the investigation. And I'm advising you, you must know the investigation which is requested for every disease, but don't abuse investigation. Don't do blanket investigation. Okay, no. You must know if I am doing investigation, what I am searching for. Okay, so
Okay.
anyone can tell us what the investigation will be requested for this patient?
Me?
No, we asked you.
Oh,
Another, another one. Even Musawi.
Yes, doctor. For to diagnose scarlet fever, we can do the gold standard is throat swab culture. I think.
Swab culture looking for
The group A beta hemolytic. Group A beta hemolytic streptococcus.
but unfortunately, Musawi culture will take about 3 days. 3 to 5 days.
Yes. Another one for the diagnostic test, maybe we can do for the antibody testing. Looking
No,
for
this
the
rapid,
specific.
yeah, rapid antibody test for it. It is very rapid and it came to you within 30 minutes if you suspect it. Okay, which is very important. And another one which is more recent is the ANA for streptococci. Those are very sensitive and can, yeah, ANA for the
nuclear antibody,
not the general anti-nuclear. Yeah, it is available now in the developed countries. I think it will be available. Alhamdulillah, for the investigation wise are very good. Okay, but some investigation are a bit costly, so we still propagating it. So that is the important. Of course, the basic investigation like full blood count, the ESR, the CRB, all this can help us. Okay, can we come now for the differential diagnosis?
Okay, sure. My first differentials would be Kawasaki disease.
Okay.
The points for Kawasaki disease are prolonged fever because the child has fever more than 5 days. The macular papular rash on the abdomen, and also there were mucosal changes in the mouth, which are injected pharynx, and also on the injected pharynx from the history. And for points against, no conjunctivitis, no edema of the extremities, especially the desquamation and peeling of fingers, and also no lymphadenopathy, especially at the cervical area. My next differential would be measles. The points for are macular papular rash that lasts for 6 days, and there were associated symptoms which were fever, coryza, and cough. The points against, the child is vaccinated. There was no purulent conjunctivitis, no Koplik spots. And also there was presence of sore throat, which is unlikely to be measles. The next differentials would be dengue fever. The points for, because the child has prolonged high-grade fever that lasts for 2 to 7 days. And on the day of illness, which is in febrile phase, the child have macular papular rash and it is blanching in nature. And dengue is also epidemic in Malaysia. The points against: the child and the family not live in dengue-prone area, no joint pain, retroorbital pain, no nausea, vomiting, and there were no warning signs of dengue that is noticed by the parents, which were abdominal pain and tenderness, persistent vomiting, diarrhea, any signs of fluid accumulation, mucosa bleed, tender liver, and altered conscious level.
So you didn't specify what is the shape of the dengue rash. What you are describing the dengue rash.
Island of what in the Sea of Red?
Yes, please. You know that Malaysia is a country of many islets. So remember, it is white islets in a red red. Okay. Good. And sorry for the rash of the scarlet fever. Remember that as you said, it looks like sandpaper. It means it is better felt than seen. Sometimes you are not seeing it, but if you come to the skin and try to put your finger in the skin, you will feel it as if there is a sand really. Because sometimes it is not so clear like the tongue, like the other rashes, okay? So remember it, please. Try to touch the skin to feel the sandpaper feeling. Okay, continue, Rafika.
With the investigation?
Okay, do you have OSCE or not? Because time is running.
Yes.
You can go ahead and try to finish within 13 minutes, inshallah. Okay.
Okay, for OSCE, I will pass to Irdina to present the OSCE questions.
Yeah, so can you hear me? Hello?
Yes, we can hear you.
Okay, so for OSCE, the first question is, a 5-year-old has been ill for 2 days with fever, decreased appetite, and a rash. On physical examination, there is ulcer noted on the tongue and soft palate, but the gingivae are spared. You also see oval vesicles with surrounding erythema on the hands. So the question is, what is the most likely diagnosis? What are the causative agents? And also give two differential diagnoses for the mouth lesions. So can I have Sawa to answer this question?
Okay. For what is the most likely diagnosis? I think because I think is mouth and hand and mouth disease. And for the causative agent, it is Coxsackie virus, Coxsackie virus A16, and enterovirus 71. And the two differential diagnoses for mouth lesion is ephtostomatitis maybe, and also gingivostomatitis. And other two differential is I cannot think of any other thing.
Okay. Is there any? Yes.
Hello?
Continue. Give them the answer. And
Sorry, I
Hello, do you hear me?
Irina, are you there?
Yes.
Hello?
Yes, we can hear you. You can continue.
Okay, okay. So so Musawa have answered right the all the three questions. Sorry, just lost just now.
Yes, yes.
Okay. So for the answer, wait. Okay. So it's the most likely diagnosis is the hand, foot, and mouth disease. So what are the causative agents? Good. The Musawa answer virus and also enterovirus.
Yeah.
And then give two differential diagnoses for the mouth lesion. It can be aphthous ulcer and also herpetic simplex gingivostomatitis. Okay. And then for next OSCE, a 3-year-old girl is brought to your office for re-evaluation of a fever that began 6 days ago. The mother tells you that her daughter's temperature has been as high as 39 degrees Celsius. And then her physical examination was unremarkable when you examined her 3 days ago. But today you note injected sclera, crack and red lips, a strawberry tongue appearance, and a swollen and non-tender cervical node. So the question are, what is the most likely diagnosis for this patient, and what is the important test that should be done at time of diagnosis and why? So can I have Adib to answer this question?
Yes. I believe this is Kawasaki disease. And what important tests should be done, like what Dr. Musa has mentioned. We have to check for the heart. So we can do echocardiography.
Yes, true. Okay. Thank you, Adib. So the most likely diagnosis is true Kawasaki disease, because as you can see, there is injected sclera, crack and red lips, and then strawberry tongue, and also swollen and non-tender cervical nodes, which is characteristic of Kawasaki disease. Also, what is the most important test that should be done at the time of diagnosis and why? True, like what I did say before, that we have discussed before, we should do echocardiography to assess if there is presence of myocarditis, and also to assess presence of subclinical myocarditis, and to evaluate any coronary artery disease. Okay. And then next question. So you are evaluating an 8-year-old girl who recently moved to your area from South Africa. And then she complains of a sore left knee and tells you that yesterday her left ankle was sore and swollen. On physical examination, her left knee is painful and tender with motion, mildly swollen and erythematous. Her left ankle is mildly tender. There is also pink macular erythematous rash on the trunk that has central blanching. So the question is, what is this lesion and what is the most likely diagnosis? Can I have Atika to answer this question?
You are giving them offer for a few minutes.
So this condition is erythema marginatum, and then the most likely diagnosis, of course, the rheumatic fever.
Why? Why you diagnose rheumatic fever?
So basically, for erythema marginatum, it's one of the diagnostic criteria. It's in major, yeah, if I'm not mistaken.
So you must come back and revise the Jones criteria for diagnosing the rheumatic fever and the other criteria for diagnosing subacute bacterial endocarditis. Please finish it and put it in one slide. Okay, it is very important. Okay, go ahead.
No, I'm sorry, I can't hear Atika.
Sorry. Continue.
Hello?
Yes.
Can you hear me?
Yes, we can hear you now. Go ahead.
Sorry. So, the answer is, so what is the skin lesion? True, Atika answered erythema marginatum, and for this kind of lesion, the most likely diagnosis would be rheumatic fever. So why it is erythema marginatum? Because as we can see that the characteristic of the rashes, there is pink macular erythematous rash on the trunk that has central blanching. So it is erythema marginatum. And then there's also a joint involvement, okay, in this patient, which is characteristic, one of the characteristics in one of the clinical features in rheumatic fever. Okay, that's it.
Okay. I think we still able to add a more OSCE. Okay. We need just to come back to Mr. Google to check for the photos about different differential diagnosis. Okay. Another point, we need to add Steven Johnson syndrome. Anyone knows what is Steven Johnson?
It's the reaction to certain drugs. It's a severe reaction.
I prefer to add on the introduction, it is life-threatening condition due to blah, 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 because it is very dangerous. If you didn't diagnose, the patient immune mechanism can deteriorate very rapidly and give a bad prognosis. So you must put 1 or 2 slides about the erythema marginatum and the erythema multiforme, erythema, okay, and the Steven Johnson syndrome, which are very important. Listen to me. Skin is a very wide introduction to the body, and many systemic disease will be presented in the problem in the skin. We know some, like if we see butterfly, we are going to say this is SLE. If we have some rash like viral infection, if we got some neurocutaneous disease, remember it every time that the neurocutaneous disease is a very common. We have a big list of it. We must know at least the name of all and some details about some of them, like neurofibromatosis and other, which are very important. So you must put all this in your mind. And if you are able to open some textbook about dermatology, you will find a very, very, very good photos which can guide you. Even here, we are speaking about hand-foot-mouth disease. In developed countries, they are speaking about Whitlow. Whitlow is the child got herpes simplex, and he used to put his finger in the mouth. Usually, he will get 1 or few lesion of vesicular rash of the herpes, which is very famous there. It is not hand, foot, mouth, because there is nothing in the foot, and the hand, it is limited only to the finger. So you'll find in the literature a lot of hundreds and thousands of cases, okay, which must be ready to understand the 2 things. Number 1, the typical disease. Number 2, the atypical disease. Now we are speaking about atypical Kawasaki, atypical measles after this one. Even now, we are seeing atypical COVID. Before it is going to the respiratory, now it will start by the GIT. Another one will come without, and then all immune system will drop abruptly, and the patient may be expired. This is very dangerous. Atypical presentation and the differential diagnosis. If you are keeping all this in your mind, sorry, if you put it in your software, you will be able to diagnose a lot of cases. You will be a good expectant doctor. You are going to rule out the bad things, which is the worst scenario in every situation, which is your problem. Don't neglect until you came to our diagnosis. Oh Allah, this patient with leukemia, but I missed to ask for full blood film from the start to rule out this patient was like that. So it is very important. Our responsibility in front of Allah, in front of our patient, in front of our job for MMC, for everything, is to prepare yourself. Now we have 1,000 day to work through it, to have this ability. Your ability is your clinical skills, is to rule out very bad scenario, is to put a differential diagnosis to diagnose things early, inshallah. Okay, I hope you picked some points from my side, and hoping inshallah for you the best for now and for the future. And I'm praying Allah to help you to make use time of your this lockdown and these days of COVID. But remember to put a lot of photos in front of you, a lot of OSCE, because it will give us some feeling as if we see already the patient. Okay. Thank you, and hoping inshallah to see you again. Do you need to ask me any question?
Doctor, actually, I have question regarding the infection by group A strep. So there for scarlet and rheumatic fever, and also glomerulonephritis. So the causative agent is the same, but then we need to see the presentation, right? For scarlet fever, if the child have fever and rash, so it will be more likely to be scarlet fever rather than rheumatic fever. Rheumatic fever, we need to fulfill the criteria, Jones criteria. Then only we can diagnose rheumatic fever.
There is also now.
Is that correct?
Yeah, you are right, because there is different strain. I just tell you that, do you know that influenza, how many strain of influenza? We know that it can maybe A or B, but there is about 73 strain of influenza. All of them are influenza. Did the same group A, beta hemolytic streptococci. If you are going to work as in the lab like that, you will know how many strains of that. So some strains prefer the heart, some strain prefer the kidney, and you must suspect this complication. Okay. Thank you.
So as for one more question, sorry,
Yes.
doctor. So as for my case just now, the child might have scarlet fever, but it is only day 6 of the illness, so it is less likely to get the complication of scarlet, which is rheumatic fever, right, doctor?
No. I mean, you must make difference between both. Acute rheumatic fever, okay, usually it have a tonsillitis about 10 days, 2 weeks before, until the body started to make the defense. Scarlet fever is a reaction by the toxins which come from the disease. Okay, so it's different mechanism. Scarlet fever itself is not an autoimmune, but rheumatic fever and the post-streptococcal is autoimmune, which will occur. It have a time gap between both of this. Usually, a patient of rheumatic fever will tell you, I have tonsillitis about 2 weeks ago, and I got a course, but I didn't complete it, and then I started to feel pain in the joint, and then blah, 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 blah. The patient with glomerulonephritis will tell you, I got infection of the skin, I have scabies 3 weeks ago and started to treat it, but I have some infected area. After that, I started to get my urine turned black or tea color. That is the issue.
What I mean just now is on what duration that we need to be concerned that there will be manifestation of complications of scarlet fever, such as rheumatic fever.
No, scarlet fever
usually
is a different.
How long?
Different mechanisms. The scarlet fever is definitely, it is with the infection. which is present now, can cause scarlet fever. Okay. But the rheumatic fever, you need to get history of tonsillitis, and then again maybe 7 days or 10 days or 1 or 2 weeks, and then start to get fever again, and the autoimmune mechanism will go to start and cause that problem. Is it clear? Hello, the internet is not working?
Yes, doctor.
Okay.
Okay, thank you. Understood.
Yes, thank you.
Yeah,
Remember,
the line was quite unstable.
yes, no issue. Remember that the autoimmune need a gap for the immunity of the body to prepare itself, and then it will start to evolve the new era of the disease. Okay. Thank you, and see you inshallah soon. Assalamu alaikum wa
Thank you,
rahmatullah.
Doctor.
You are welcome.
Thank you, Doctor.
Waalaikumsalam. Thank you so much,
Waalaikumsalam
doctor.
warahmatullah. Thank you very much, Doctor.
Thank you, Doctor.
الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا